Welcome, Lana, to the root of our house. It is such a pleasure to have you on the show. Thank you so much for taking out the time.
Oh, it's such a pleasure to be here. Thank you for inviting me, Elizabeth.
Of course, of course. Just going to dig right in. I mean, the first question, right? CO2 Lift, what is it?
It's the first topical gel delivery system for carboxy therapy. And then, so the follow-up question would be, what is carboxy therapy?
Exactly.
Carboxy therapy is a therapeutic use of CO2 gas, hence the name CO2 Lift, to regenerate the skin. It's a natural thing that your body will do. It's called the Bohr effect. That's the mechanism of action. What happens is, in layman's terms, when you put CO2 gas into the skin, the body's going to respond by rebalancing it by rushing oxygen-rich blood to the area. Along with blood, the fresh, nutritious blood will come your exosomes, will come your growth factors, will come your hydration, the water. And then also the waste will escape, because in order to do that, your capillaries increase, so the waste leaves, and then you have this fresh supply. So that's why you have such rapid skin turnover.
Okay. Awesome. Well, that's amazing. So then the other question is, how did you get into this? What is your backstory?
Yes, okay. So,
It's a long question, I'm sure.
well, my educational background, I'm accounting and finance. So that's many years ago. Worked in that for a little, then went back to school and studied nutrition, and then opened weight loss clinics. So I've been in weight loss for over 20 years, and really focusing on helping, people to improve their lives by reducing body fat, improving their health. And it was sort of a natural transition, when people started looking and feeling better about themselves, they started wanting to do more to themselves. So we said, why not open a med spa? And in that, we had an office in there, and that focused on weight loss still, but then we had these rooms for skincare, and just looking for something very different that would help people with their skin. Because even our weight loss was very different program too. So I always like things that are different, and I would interview people. What do you use on your skin? What do you do for skin? Found out through one particular woman who had great skin that she did carboxy therapy, but that was with a needle. So just, research, looking for other ways in which it could be done. The Japanese, actually have a long history of using carboxy therapy through carbonic hot springs. So you'd go to these carbonic hot springs, like the samurai warriors would, after battle, go and bathe in them. That's how it dates back to that time. So, we looked into that country because they're very advanced, technology wise. They have a history of it, and these scientists developed a new way to deliver CO2 into the skin versus a needle, which was developed in France. It's a gel. So we have the exclusive license to that technology. And CO2 Lift was born.
Oh, nice. Very nice. Yeah. I mean, we always want some sort of, I don't want to say quick fix, as there's never a quick fix, but the top of the line care for our skin, right? Because it's very fragile. Our skin
Mhm.
is very fragile in general. So if you can describe or talk to me a little bit about like the chemistry behind it, like the science behind it, or the ingredients, either one you want to kind of touch on, like what's outside of the CO2, like what's really involved in these skin products, and actually what do you offer?
Okay. So the magic behind the CO2 Lift carboxy gel is really the CO2. That's the work, because you have other
Okay.
ingredients. Since you'll have squalene, you'll have ceramides, you'll have peptides, all those other things are in there, but and which are great for the skin, by the way. But then when you think about carboxy therapy and you think about reoxygenation of the tissue, that can only happen from something that you're doing internally. I mean, people will go, I think the closest comparison would be going inside of a hyperbaric oxygen chamber. So some people may understand that, and that has very therapeutic properties. It's very regenerating for the skin. this is better because it has none of the contraindications of using that. And some people don't like going into a closed environment. I mean, there's so many, if you have problems with their eyes, if you have that may not be the option, but the CO2 lift is transportable. You can get it in your doctor's office and you do it at home. But the magic behind it really is a CO2 gas. So we have a patented formula, and that's really the secret sauce as to how is it that we're able to get the CO2 into the tissue. Because you see, it needs a certain pH. Because when people think of CO2 gas, they're thinking, or CO2, they think of a bubbling sensation, like for instance, some kind of soda, bubbles. And so
Right.
from the time that we launched, and we've seen other CO2 type of products, it's not penetrating the muscular level. So they'll disclose on it. You can't put it on open skin because it's really surface. So what we're talking about is very different. We're talking about penetrating to the muscular level. And that way, the oxygen-rich blood can rush to that area. So it's a gel. So it comes in 2 packets. You mix it, and that's how the CO2 gas is. And then the patented formula allows you to push into the skin in whichever area of the body that you apply it. So that's why we have an application for the face, the neck, the body. Then we have one for the vulva vagina, which is different in terms of the pH of that, and a little slightly different formulation. But you can really apply it to the entire body, and you'll see what will happen. What will happen is that first you'll get a glow. It has a natural glow because, again, you are pushing hydration to the skin. And one of my favorite sayings is, you don't get old, you dry up. You see, think of a grape and a raisin. We all are born this grape. Our grape-like skin is plump. It's fresh like a baby's bottom, just plump. And then we turn into this raisin. What is the difference between a grape and a raisin? The difference is the hydration. There's no water inside of a raisin. It's just a dehydrated grape. So fortunately, we have the technology that slows that process down. And that's what the CO2 does. One of the things it does very effectively, because it puts in over 117% hydration into the skin after one application. That's very significant.
Wow.
Related to there's really no other skincare product that can make that claim. You'll say significant increases in hydration, because I really can't tell you a figure that's going to be that exciting. It's over 170%, and that's what you're seeing. So when you think of a tall glass of water for your skin, so that's why when you put it on, you're going to get that glow. It's just this, like you drank, your skin just looks hydrated. But beyond that, it's doing things that are important for the health of the skin. So then we're talking about elasticity. So our last clinical study that we did, well, that's not the last one, but one that we did earlier this year, it showed that after 6 applications, your elasticity in the skin increases 26%. Now, Elizabeth, again, that's a very significant number. There's really nothing that you can do to do that besides maybe doing an energy-based device, and then you still have to wait 6 months. We're talking about 6 applications that you can do within a month and get 26% increase in elasticity. Beyond the fact, wrinkles we decrease. I mean, double digit for wrinkles, luminosity increase. I mean, you're talking about fine lines. You're talking about even with chronic dry skin, people who have eczema or even like rosacea or psoriasis, we have great results for people because it's actually treating the skin barrier.
Okay. Amazing that this technology, and are you the only one with this? Is there, do you know? Okay. Wow.
We have the exclusive license to that technology. So yes, we're the only CO2 lift all over the world. And we launched this product in 2016. And I'm very, very proud of the kind of results that we get and the kind of reactions that we get from a lot of especially in the medical community, because I think when we started, oftentimes you think a gel, what can that do? But when you see a gel that can close a non-healing diabetic ulcer in as little as 8 days, that is
Wow.
fast.
Yeah.
So, I always say, there are different ways. There's so many skincare products out there that are really good. This, by the way, will help your skincare products to work better, because even as we get older, moisturizer, or because our skin gets thinner, the moisturizer just really sits on top of the skin. By using the CO2 lift, thickening the skin, you can have, a greater sponge to hold that moisture.
Yeah.
But so it makes other skincare products look great. But I always say that, there are many ways that you can get to Japan, right? You can take a boat.
Yeah.
and you
Yeah.
can get there, or you can take a jet plane and get there
Yeah.
faster, right? But the CO2
Yeah.
lift is a jet plane. It gets to the results in the fastest way, and yet without any pain or downtime.
Okay. Awesome. And so who is this like really for, like this for? Is this
Okay,
for anybody like in any age? I mean, I would assume a little bit older, but so if you can talk to me a little bit about the clients or the customers.
good. Elizabeth, I cannot wait for you to get it, for you to try to see, so you can see, because I know
Yeah.
just telling you is hard to. And of course, people can go on our Instagram and see how it looks. But it's, first of all, it's a very cool application, and again, can be applied anywhere on the body. Because people, I've seen physicians who treat people as young as 8 years old because of eczema. So they're using this to treat skin conditions like that. So young people can use it.
Okay.
But really, when we designed it, we're looking at skincare. And the unfortunate thing in our culture is that we start at a later age. And I think it's changing because, in fact, I never even, for my, I mean, just the information that I had, and I'm, 52, the information that I had, I didn't, I see a lot of younger people, like they're starting in their 20s, which I never did, like early 20s. But if you look at a lot of the Asian countries, like Korea, they start at 15. And if you can lock that in, start at an early age, you look younger longer. But yes, so the CO2 lift can be applied for anyone, for men,
Mhm.
female, regardless of your race, color, um, you know, it's whatever demographic. If you have skin, you can use it. It's just a matter of what it is that you want to achieve. So, but for anti-aging or for prejuvenation or for whatever the word is that they're using right now, you want to
Yeah.
start early, and you start, I would recommend, you know 18, 19, start early, because that way you stay younger for a very long time, and it's not a very expensive product. But yeah, so for, obviously, for that, for the face and body, you can start at any age.
Yeah.
For the vulva, vagina, I think a woman should start in her 20s, because when aging starts, at, your blood, your circulation starts slowing down, and aging starts from what they say around 25, right? So if you think about, so definitely for our face, and most people are aware of that. But one of the things that I like to shine light on, especially for women, is that we need to think about our, our intimate skin, our vulva, vaginal skin, because like the skin on our face, that too is aging, but it has the consequences of that, means our quality of life will be lessened when we get older, because our clitoris, which is our main center for pleasure, besides our mind, of course, for women, it requires blood flow to be healthy, and that starts slowing down. So if you don't do anything about it, I mean, you're looking at in your 30s, it's going to, your sexual experience or your sexual enjoyment will be less, and then you get into your 40s. So you want to start younger to maintain that blood flow. And then, of course, the tissue, the tissue, the vaginal tissue, you want to keep that thick, right? Because that starts
Yeah.
thinning as well. I heard a gynecologist told me that a woman's true age, you can see it in her vagina. And you can understand why
Interesting.
that could be so, because we're not doing anything to treat it. We don't even, we neglect it. And I think it stems from, and I did a podcast interview with a surgeon about a month ago, and it was an interesting thing he said. When you think about the medical term for that area, it's pudendum, which means shame. So you think about, that's really our culture as females. We have some shame around it, so we don't talk about it. We feel that it's not, we feel that if we describe anything wrong with it, is a reflection of who we are, when it's a normal part of aging, of just getting older, which we can, like, just
Yeah.
like skin on our face, we can do something about it. So, for those
Right.
applications, for the mask, and we have other things that use carboxy as well, but those are the main ones.
Yeah. No, thank you. And yeah, I was gonna get into more the, the vulva and the vagina, sector, because we don't think about that. We don't. We it's kind of like, and I was, as I was doing research, I'm like, yeah, I never really thought about doing anything for the skin around there. Like, I just, you take care of it in other ways, but there's just like, okay, it is what it is. And then also you hear people like, I don't, you were saying like drying up or pain, if you have pain because of that. So then you put, ointments and stuff in there. So to have it, I mean, why not face and then, the whole body? Why not? So that's, yeah, I'm glad that you're touching on that in terms of, because I know that there's other companies in integrative areas that I've interviewed, that does things specifically for the vagina. Like there's cold packs, and then there's like light therapies and things like that. But I've never heard of like a skincare, cream or, something like this that definitely plumps up the skin.
Yeah.
So that's amazing.
Yes, and Elizabeth, it's not only externally. So that's our vulva, right? So we want to keep
Yeah.
that air pump, and we want to keep it. We're talking about blood flow, which is the vulva. And that you're getting
Yeah.
from gel, but we're also talking about the vagina. So internal. So it's implied like almost like a tampon, and that is really
Yeah.
helping with the quality of the tissue. So that's functionality. That's talking about, then we help with pH, because as a woman, as we get older, our pH goes off, so this keeps it balanced, so we prevent having so many infections. So again, just to say, just to your point, we think about, we do our face and we have lotion, and we lotion our arms, our legs, our our torso, but we kind of leave out that area, because we're like, what does it need? What do we need to do with it? I was the same way.
Yeah.
What, okay, but the outside is one thing, but also internally, because everything for us is internal down there. What do we do to reverse the effects of aging down there? Because some of the things that happen as you get older as a woman, you're going to get vaginal dryness, you're going to get, your pH is going to go off, you're going to have painful sex, it's going to be thinner tissue, it's, your orgasms may not be as strong. I mean, all of that are some of the things that we can avoid, we can prevent, or we can reverse. And we have the technology to do that. And Co2LiftV as an effective technology, because it's something that you can do in the privacy of your home, which is another thing. So you have control over how to manage that for yourself. I mean, we have recommendations as to what someone would do, but basically it gives you a level of power to know that something you can control. You can just do a CO2 lift and you're good. So this is not, it's not a lube. This is basically a treatment that reconditions vulva vaginal skin. So once a woman does, depending on where she is in her life. So if a woman started 40s, I know that's your audience, or a lot of your audience, I mean, I would
Mhm.
recommend for them to do 10. Because if you are 40 and you haven't done anything for vulva vaginal, you need to do 10. So you would do 5 and maybe take the weekend off, another 5. You would experience such a difference in everything for you. And then you can maintain it by doing monthly treatments. So that's the typical protocol that we would recommend. Or when a woman just has a baby, that's another thing that when I had my 2 children, no one talked about those things either. But you go through a change in your estrogen levels, so you get dry eye, breastfed, so all of that. Well, a woman breastfeeding, having a baby, physicians recommend you do it right after childbirth, because it's going to help with the inflammation and the swelling, as well as getting that area back reconnected. And so they would do, maybe they don't need to do 10, maybe they just need to do 5. You see, and then after that, once a month while they're breastfeeding, to keep down there lubricated, because they're going to be drier.
Awesome. All right. Okay. Um, Question that I have a little bit is, how much does this kind of coincide with a healthy lifestyle? I mean, I'm just wondering how your approach is to your products in terms of, again, the customers, obviously, starting young and getting older, but, you know, being in the preventive space, always want to make sure that any, my listeners, any, clients, anybody is taking their, behavior, like their lifestyle, into a more healthier lifestyle. So obviously this is helping to plump up the skin and everything, but is it alongside, some nutrition, some exercise? How do you touch on that? What's your thinking about all of that?
Well, having a nutritional background, I mean, that plays a part in in a lot of my conversations. I mean, certainly, taking care of your body and taking care of your body holistically, you're going to want, good nutrition is important. I mean, drinking. One of the things that I always find as a common denominator when people start having issues with health is they may slack off drinking water. I mean, I'm a big proponent of drinking a gallon of water a day. I mean, my habit has been for the last 30 years. I get up in the morning and I pee, I weigh on the scale, and then I drink, a liter and a half of water. That's pretty much what I do. So by midday, I would have had at least 2.5 liters, almost 3 liters of water. So then I just need another liter and I'll be at a gallon for the day. So that's a big thing I feel is important, and also limiting alcohol, not too much alcohol. I drink whenever I go out socially, but, we really are seeing so much more information showing how that can age you. I mean, not only age you externally, but internally. And so it affects so many different things. So we always, talk about these different things. I think that, the skin aspect of it, skin is your largest organ. And that's something that affects your image. It affects your mental health, just how you look and how you feel confident in your skin. So that's why we talk about taking care of your skin, and the CO2 lift for even people who are not into complicated skincare routines. Men, for instance, my husband is not into he does one thing, but the CO2 lift is something easy that he can do. My boys, they do a CO2 lift once a month. I mean, they've been doing it since they were like 15. I mean, it's funny how, but it's a simple way to keep your skin health. And then, of course, we talk about vulva vaginal health. That's something that a woman should think about in her 20s. Vulva vaginal health, keeping that area, not only with the CO2. Another thing I use for that area, skin moisturizing is important. I use our Glow. So we have a Glow serum, nothing to do with Carboxy, but it has really good oils. And I use it, after I shower, and you keep that area moist. So I feel that, supple, healthy skin, it makes you feel good, like even in your skin, feel good. And then of course, emotionally and mentally, you feel good and confident. And I think that's important for a healthy lifestyle.
Yeah, no, I completely agree. You mentioned obviously water, again, I carry water everywhere, can't live without it. Alcohol, definitely dehydration.
Yeah.
I personally have gone sober since August, and noticed, obviously changes in all, factors of my body and health. Um, and yeah, it is keeping your skin, keeping your internals, externals kind of vibrant.
Yes.
And with that vibrancy comes the confidence. So
Yes.
I think that's where you were going with in terms of, that's what we want when we age a little bit, is more confidence. So how can we get more confident in, and it's not always looking, obviously we know that we're going to get older.
Yeah.
We know that things are going to happen. We know that, I mean, I'm growing out my hair, my, grays. I don't mind. We know this and we just want to embrace it. But obviously we also want that confidence in where we look in the mirror, and yeah, we're going to see some changes, but we're also going to see some amazing changes in terms of, okay, well, there is a way to keep your skin as vibrant as it should. As you alluded to the grape and the raisin analogy, that's a great analogy, because that's exactly what we are. Our skin looks like it does dry up, and we think that we have to kind of deal with, I guess the word is deal with, these changes in terms of wrinkles and all of that. But I mean, I said this before we hit record, but your face is just illuminating in here, and so we can definitely see the effects, and I can't wait to try it either. So yeah.
Yes. I had another call like this yesterday, and we were talking about, I'm at a dermatology conference right now, so you're talking about fillers and Botox and all of this, and my comment is that regardless of what, it's still about skin quality, because if you could use fillers and Botox and eliminate that, and nothing is wrong for people who choose to do that. The thing is that you still need to think about the quality of your skin, because you can have that and your skin looks like leather, but you can have someone who has wrinkles, but their skin quality is vibrant, and they just look, it's attractive. So that's what we're talking about. We're talking about the quality of your skin, which
Yeah.
it should have water. And even as much as I advocate water drinking a gallon of water is not going to help that with your skin. Just so you know that, you still can have dry skin. So something like a carboxy therapy, and I'm saying something like, but I don't know what else is equivalent to it, to be honest, because I'm in this space and we invest heavily in clinical studies and in comparisons. There's really nothing that's going to bring your level of hydration in the skin to this, like this, and also doing the other things that we talked about. So, and every time you do it, it gets better. It always improves for your face. Also, the quality of your vulva, vaginal quality of, in
Yeah.
terms of functionality, that improves every time. It gets better and
Yeah.
better. But so I think I left the point, but just to your point, you want vibrant skin throughout your whole body. So yes, you're getting older, you're getting more experience, but guess what? You can still look youthful and feel youthful, because there's a technology that is available that you can do it from your home. You don't even have to go anywhere to do it. You can get it and do it at home.
Yeah, and that was my next question actually, was how is it like for the first, timer, say me, or it's just as if it's ordering a product online and having it at home. Is there a protocol? Is there something that goes along with it? What is the customer experience?
Yes. So I find that, I like when people do it first in a doctor's office, because they see how it's done, or either esthetician doing it, they feel, and then of course, you have someone doing it for you and they're professional. However, it's a very simple um, process. You're just mixing it. You're mixing the two gels together like cake, and then you're applying it to your skin like cake batter or like icing, and you put it on.
Just
And you
don't eat it.
can. That's a good thing. You can. If it goes in your mouth or eyes, it's nothing is wrong with that. Yeah.
Oh,
Put it right.
okay.
And that's a great thing, because you can put it right up to your lash line. Because a lot of people see aging first in the skin under your eyes, which is very thin. And by the way, that thin skin that's under your eyes, that's the same type of skin that's down there. So that's the thin vaginal skin. So you're seeing it in your eyes. You can put the CO2 lift right up to your lash line and right over your eyelids. And you put it on thick on your face and your neck. And I always tell, especially women, don't forget your neck, because you can see, and I see it on TV all the time. You'll see women, they look good because they've done things to their face, but they don't take care of their neck, and their neck gives.
Mhm.
So definitely to your neck. And then you leave it on for 45 minutes, and then it peels off. It peels off like almost like jelly. So you just peel it off and it comes right off. And again, if you look on Instagram, there's so many people doing it, and they have fun doing it. And then you can do that again to any part on your body. So some people do it for crepey knees, or some people do it on their stomach. Some people do it I've seen some doctors use it for cellulite. So they're using it different places in the body. So it's an easy peel off. And again, I always recommend that people do at least 6. So they want to do 1 a week, or you can do it. Some people recommend they do 3 a week, like quickly it's like a loading dose. It kind of builds it up in your system, and then you can do monthly treatments. So I've been doing this obviously since we started, since 2016. And I do, from the time that I turned 50, I've been doing 2 a month. So sorry, yeah, 2 a month. So I was thinking maybe I don't want to. When we went to Osaka and just visiting, with our manufacturer, she does 2 a week. She's 71.
Oh wow.
She looks incredible. When I tell you, she look, her neck looks like a 30-year-old. Just so I was like, maybe I should do some more. But I mean, I can go on time. But yeah, but I mean, I would recommend at least, at least monthly. But I've been doing twice a month. And then For the vulva vaginal, you want to do, again, as I mentioned before, depending on where you are, 5 to 10 treatments, and then monthly to maintain it. We had we had a great webinar last week with a panel of really great urogynecologists and some other doctors, and they were talking about their experience with the Co2LiftV for their patients. But what really touched me was there was one of the doctors on who actually had lichen sclerosis. So she, beautiful 40-year-old doctor, and she brought the CO2 lift into her practice because of how it benefited her with her lichen with the V. So one of her PAs had gone to a meeting and met us and brought it back to her, and she's seeing these products on her desk, and she and her husband are both doctors, and she's been suffering with this. And I don't know if you know what lichen sclerosis is, but it's a
No.
condition of the vulva vaginal tissue where it can look, sometimes you can have fibrous tissue will grow up, so there's no, the opening is closed, or it looks it's very scaly, it's itchy, it's peeing maybe uncomfortable, definitely sexual intercourse is for people sometimes impossible. So she's been suffering. I don't know what level she was at in terms of what she was experiencing, but for 20 years she's had this. She bought the CO2 LiftV. She bought 15. So she bought the 5-pack. So she bought 3 of them. And she says after she hadn't even gotten to the third. So after 10, she noticed huge difference. Her husband and her took pictures. They just loved it. And so result of it, they brought it into their practice for both the face and the CO2 LiftV.
Oh, so definitely works, of course. Of
Yes.
course. Well, thank you for going through all of that, and then letting us know, exactly the steps and everything along with that. Is there anything that I haven't asked that you would like to talk about, bring up, discuss, anything?
You did such a great job. I think that I think that my message, is always I focus a lot on the CO2 Live V in my conversations. The face is important. I always say, the face gets your man or your partner. That bottom part keeps them, right?
Mhm.
But it's not only about that. It's about really just taking charge of your womanhood, your health, your confidence. And I think that I would like to encourage more women from an earlier age, don't wait, because sometimes when you wait to start fixing these issues, it's harder to reverse. I mean, I'm talking about even in terms of with hormone therapy and anything, just in terms of intimate health, your whole body. I always say women should start checking their hormones from their 35, at least. At least to get a baseline of where you are so that you can supplement. And, of course, just again, so the CO2 Lift to me is a great option for women. But whatever you look at, think about taking care of that area, because it's going to mean that later on in life, it's going to keep you feeling and looking youthful. Yeah.
Yeah, no, and you hit it on the head, meaning it's not just what we see in the mirror.
Yeah.
It is probably more so how we feel as a woman, right? And the more we get older, the less sometimes we feel like a woman because of the hormone changes that happen. However, sex is not always off the table
Yeah.
because of the hormone changes. It can
Right.
definitely be even um, like reignited or even ignited in general, and just keeping it going. And how can we do that? And again, I bring it up to where that is why bring you, or not just for the vaginal and the vulva and the private areas, but also the whole skin. But it's just the more natural integrative ways that we could just again make ourselves feel younger, make ourselves, I mean, again, more vibrant. I keep going back to that word, but it just kind of pops in my head. That gives us confidence to where then our sexual peak increases, where
Yes.
people think that, oh well, I'm 50, that's it for me, I'm done. Uh-uh. No, it's just beginning. It's
Just
just beginning.
yeah, so and I mean, for women getting into that, people are like, I'm going through menopause. Great for you. It's just, it's to me, it's, I like to think of
Right.
menopause as a new, it's a new era of confidence that we can have. The childbearing age is they're over, and it's now a new exciting time to explore. And so we want to be in a good situation in our health and in our body to be able to enjoy that, so
Yeah.
I
Yeah.
and it's definitely sex is important. Sex is important in relationships. It's the bridge that connects two people together. And so it should be something that you should think about. And I speak to so many women who say, I'm done with that, or their husband will get it once a month or their partner get it. I'm like, and they're doing themselves a disservice, because it's more than just about the connection with your husband. It's a connection with yourself. So
Yeah.
definitely, and one of the things, and I'll say, we've done 2 double-blind clinicals. We're in the process of doing a third in the United States, because those were in Argentina. So we're doing a third here, and we added stress incontinence as an indication. But what that means is, when you say double-blind, means the patients who are enrolled, they don't know if they're actually getting the CO2 lift or they're getting an ultrasound gel. So it comes in a very similar package, and it looks the same. So they're applying it.
Hmm.
We'll tell the women that they'll eventually, the ones who didn't get it will eventually get it. So they get the questionnaire. So the first step is they get the questionnaire. And what was interesting to me was an FSFI questionnaire, which is a standardized questionnaire that tests for like orgasm, lubrication, desire. What was interesting, the ones that used the placebo, the ultrasound, showed no changes. The ones that use the Co2LiftV showed significant changes, including desire, which was interesting to me, because I was thinking the placebo should at least increase in desire, because you're thinking you're getting something. It didn't. Only the Co2LiftV. And why? Because of blood flow. That's how important blood flow is. So desire increase. So if women are feeling low in their libido, definitely test your hormones, but also consider, maybe you need some recharge in your blood flow. What's going to do that for you? Well, the Co2LiftV will do
Yeah.
that. And that will help you to
Nice.
want to get intimate and want to connect in that way.
Beautiful. Beautiful. Amazing. Well, thank you so much. Where can people either reach out to you, buy these products, everything else? If you can let us know all of that information.
Yes. Awesome. Well, definitely please check us out on our Instagram, Co2Lift, Co2LiftV. Also, my personal is the Lana Kerr. And you can get, and we're going to give a link to a book which I wrote, called The Secret to the Big O.
Yep.
So you have that, and I guess you'll put in the show notes. But they can buy the product. You'll either definitely check out your doctor, or you can go to co2lift.com, co2lift.com. And I know we're giving a code. It's health15 for 15% off for anyone who chooses to buy from the entire site.
That is such a great gift. Thank you.
Yeah.
So I'm assuming, so you said you can buy it online and at the doctor? You can
Yes.
go to the doctor and get this as well?
Yes, your dermatologist, your plastic surgeon, or your med spa,
Hmm.
they should have it, and ask them about it. So they carry the Co2Lift Pro, which is a different formulation, just from the one that they're going to get online. They're going to both be effective, but obviously the Pro is stronger. They can get it from their dermatologist, or again, any of their skincare professionals will have those products. They can ask them. If not, they can go straight to the website and they can get it there.
Amazing. Amazing. That's great. So it's just easy to get. So that's a good thing.
Order, and it's going to be the same that you're going to get at the doctor's office. It's the same product.
Nice.
The CO2 lift
Nice.
faces and body's a little different, but yeah, and it's in the privacy of your home. You're do-it-yourselfer. It's easy, and we have so many videos that you can look at to see. And of course, if they have any questions, please DM us. Our social media team is very responsive. If they call, our team, our support team is very responsive. They can answer any questions as well. And also, please feel free to DM me as well. I'm very passionate about talking about this, and I'm happy to answer any questions.
Yeah, I can definitely hear it in your voice. So, and I'll definitely link up all of the socials and the information in the show notes. So with a quick click, they can get to you. So last question that I have that I usually ask all my guests is, what is one or a favorite quote or any words of inspiration that you can share with us?
One of my favorite, I have several, but I don't know, when you asked me what came to my mind, I don't know, because I was thinking about it recently. Well, there are two. I'll leave. Well, one is pain ends. I like that one because whenever I'm feeling any, even emotional, think stress, I always, pain ends. It really, it's going to end someday. It's going to come to an end. And it actually gives me, okay, this is not going to last forever. Just live it out. But another thing is that you are your own superpower. Every one of us is so different. We can bring such uniqueness to the table. I think one of the things is we don't need to be anyone else. We just need to be ourselves, to be authentic. And that is attractive. And that is, you're bringing something different because no one else is like you or me. Or so if you can think of yourself as that superpower, just you being authentic, then what can't you do? You know, and it also brings this level of humility to know that that's their superpower. In other words, that's who they are and they're unique. So we can appreciate each other. We can value ourselves. And I think it makes for better relationships, and it makes for just a better relationship with ourselves.
Amazing. Thank you. Those are words to live by. Definitely. Definitely. Thank you so much, Lana, for being here. You do have a wealth of knowledge in your space, and I appreciate you being on this podcast to share that with me and my listeners. So thank you for being here. And if you have any last parting words, you can go ahead and say it. Otherwise, we'll just close it out.
Thank you so much. Thank you so much. Thank you.
Awesome. Well, to my listeners, thank you for listening and showing up. And as always, you are worth it.